Dramatic exaggeration? Think again. Nearly 1 in 3 ER patients are mistriaged, and among those who die in the ER, about 30% were misclassified as intake. Take Brian Sinclair in Winnipeg. 34 hours waiting, died unseen. And here's the shame. Researchers have already shown that AI can make triage faster, safer, and more efficient, which is where we decided we could come in.
Caladrius, the privacy-first AI triage assistant. Let's get into the demo.
To integrate with existing triage ecosystems, we first take vital data and then we prompt the patient to use their personal medical passport, scanning the QR code, setting up a secure end-to-end encrypted pipeline to allowing us to seamlessly and securely send the PHI.
After the PHI is uploaded, we then confirm with the patient to make sure everything is correct. After confirming, they can go through their information to make sure everything is all good in the system before entering their symptoms about what they're experiencing during their visit. Then the question pipeline begins. The question pipeline begins by looking at the patient's medical history and their symptoms to generate personalized questions. It then continues to feed back into this question loop, referencing their history, eventually feeding out to a final diagnosis node, which generates 5 probable causes, as well as next steps and evidence for each type of diagnosis that the patient has. Compared to traditional nurses or traditional LLMs, the agentic loop combined with the patient's extensive medical history allows the model to dive extremely deep into specific inquiries that target the patient's symptoms and address specific concerns that the patient might have.
Now that triage is completed, the focus shifts to the nurse's dashboard that we have created. So looking specifically at David, we see that he was categorized as very high, and we were able to get very specific diagnoses backed by the comprehensive evidence of the personal medical passport as well as the strengths of the model.
We continue to provide agency to the nurses by allowing them to click and drag around patients in case they disagree with the assessment made by the model.
Now we move to highlight the strengths of the model in finding very, very discrete diagnoses. So we see Evelyn Parker, a 67-year-old woman with a pretty normal personal medical passport, and none of her symptoms are especially jarring or they stand out to even the trained eye. But now we will see that the model is digging deep on very specific questions.
So this is where we see a lot of value in Caladrius, is Evelyn's symptoms seemed very tame, but the AI was able to basically say that she's at risk for an elevation acute coronary syndrome angina, which can be very, very fatal and put her at immediate help required. So the AI is able to catch a lot of things that general practitioners and nurses won't.
When the patient updates their medical passport with EMR ingestion from a cloud system like Epic or Oracle, and this can be also updated with an on-premise HCP system for smaller providers. Then this gets encrypted and scanned to a QR code, which gives the medical passport on the patient's device a custom encrypt key, which goes to an S3 bucket and is then read by an internal triage system. Then the patient's vitals and symptoms are taken, fed, combined with this medical passport into the local LLM. This generates new questions, replies, and on completion, it goes to the HCP system, which loads up the admin dashboard for future steps and reasoning and evidence for the doctors to parse through.